Welcome back. Well, our hearts have big jobs helping to move blood through our bodies, but when your heart should, or as correctly I should say as it should, it could be a big problem. Joining us now is Dr. Dinesh Pubbi. He is part of the team at the First Coast Heart and Vascular Center. Good to see you. Appreciate you being here.
Oh, absolutely.
And this is coming up on September's Atrial Fibrillation Awareness Month. So
absolutely.
Good opportunity to tell people a little bit about a condition that you say is one of the most common, yet one of the most ignored.
Absolutely. Absolutely. I'm glad to be here. Thank you very much for having me over here. I wanted to make aware people of the atrial fibrillation. In brief, we call that as AFib. Many people feel the symptoms of palpitations, lightheaded dizziness, irregular heartbeat. This is the irregular heartbeat which comes from the left upper chamber of your heart. And most people tend to ignore it. It is the most common arrhythmias in the United States and actually, for that matter, in the world.
And so people they feel a little fatigued, they feel tired. I mean, what are they feeling? And then what's actually going on in the body?
Absolutely. The symptoms are basically 30% of the people or 1/3 of the people may not even feel any symptoms. That's the bad part about it. The worst case scenario, people feel just tired, fatigued, exhausted, shortness of breath, dizziness, the things we face across everyday things, and we just tend to ignore it. And that's why it needs to be determined and tested and picked out much sooner. Some people feel shortness of breath, some people feel palpitations. 2.5 million people every year.
And if you feel those, you should come in, obviously, to a doctor and make sure that it's checked out, any sort of palpitation or shortness of breath or fatigue. But those are such generic symptoms, though.
You're 100% right, exactly. And that's why I think most people don't go to their doctors, because thinking, hey, I don't want to be considered a hypochondriac. Or some people just say, hey, it is just my anxiety or a panic attack. But in women especially, these symptoms are very serious and they should be definitely checked out. And if you continue to have a symptom that it's not going away, insist to your doctor to do more testing than just doing an EKG. Sometimes doing an EKG, sometimes 24-hour monitors, or more testing was needed to figure it out what exactly is going on.
And what is the breakdown between men and women?
Yeah, very right question. You know, most of the time we hear about the women's breast cancer and women's heart disease and stuff. Women in atrial fibrillation are actually, men are more commonly affected than the women do. But women, by the time they get diagnosed, they are 4 years older than the men are. But for some reason, we notice that when the woman gets diagnosed with atrial fibrillation, they tend to have a higher death rates.
What is that?
What the mean is, women with atrial fibrillation, they end up dying sooner than the men with atrial fibrillation. And part of the reason is because by the time they get diagnosed, by the time they picked up the information, and by the time they start their treatment, it might be too late. So same thing with the gender difference as well as the race difference. Caucasians or white people get affected more with atrial fibrillation than the Afro-American does. Although younger Afro-Americans will be affected much more, although the later age, older white people will get affected much more.
And you have said that you are 5 times more likely to get stroke or heart attack as a result of untreated atrial fibrillation.
And I think that is the worst case scenario for the atrial fibrillation. There's 2 things we worry about atrial fibrillation. You know, one is how it makes you feel.
Sure.
Yes, I feel tired, I feel fatigued, I feel short of breath, I feel palpitations. Yes, I can fix it. But the worst case scenario is I don't want to be affected with the stroke. I don't want to have a slurred speech. I don't want to have a weak heart. I don't want to have a weak leg. I don't want to be dependent on anybody. That is the thing that bothers me the most. So the risk of atrial fibrillation and stroke is almost 5 times, 500% increase. If I have atrial fibrillation tomorrow and I don't have atrial fibrillation today, my risk of stroke is 5 times. And the best thing is, if you know you have atrial fibrillation, we have medication these days to treat it.
Well, there you go. That's my next question. Is we have about a minute left. Talk about the treatment, and can it be cured? Can you be cured
Absolutely.
of AFib?
The best thing is, there's different ways to treat it. One, we want to make sure you put back in rhythm. Sometimes we can shock people, put you back in rhythm. There's medication, there's blood thinners we use. But there are certain atrial fibrillation episodes which come and go in younger people. Those can be cured, that people may not even have that atrial fibrillation anymore. We do a procedure called ablations, where we go and find the hot spots which are there in the left upper chamber of your heart. We can go via some minimally invasive procedure. You can go from the groin, find the spots, we can cauterize them, or we can freeze them, and that can get rid of the atrial fibrillation. We do that in the morning, sometimes we let them go home in the evening,
Wow.
or even sometimes the next day. And I think that has made a big difference in impact of quality of life for the patients.
And just to come in and get it checked out, just to make sure you can prevent so many horrible things down the road.
I think the best thing is look for electrophysiologist, come and ask for electrophysiologist who somebody specializes in atrial fibrillation.
Good to see you, Dr. Dinesh Pubbi. We appreciate you being here,
Absolutely,
sir.
anytime.
Thank
you very much.
We appreciate it, and we'd like to thank First Coast Heart and Vascular Center for sponsoring this segment. For more information, you can visit firstcoastheart.com, or the number is there on your screen, 904-423-0010.